So American healthcare system, where did it all start? It's been around since the 80s. It really took off, I would say, in the 60s, early 60s when JFK started his elderly citizen, senior citizen healthcare system that was pretty rejected, very harsh criticism about that. And later he died. Um, President Johnson, after that, took it upon himself to finish the bill, in which he did, but he added in the clause that he was going to help make a plan for younger generations for when they become senior citizens, so he would plan ahead, and that's when the Social Security Act of 1965 was established. I mean, this act is known as the foundation of today's Medicare and Medicaid. Later in the 90s, Clinton was sworn in. He quickly discovered that health care expenses would be damaging to the average American and knew that something had to be done. Um, Clinton offered a solution which was called the Health Security Act of 1993. The plan offered universal health care, respecting the private insurance system. Following the HAS, the people would be able to purchase insurance through state-based cooperatives, in quotes, at which companies couldn't refuse anyone based on pre-existing conditions. Employers were not required to give full health insurance to employees. You fast forward today in the United States, and you've got a healthcare system facing national scrutiny. Since the passage of the Affordable Care Act, great strides have been made improving insurance coverage nationwide, but more on that later with the problems. But more work must be done to improve the cost of quality in healthcare. This part of healthcare reform requires that doctors and other medical professionals work together to improve the way that healthcare delivered is to patients. Accountability is a huge issue as well. In quotes, we have, for too long, American healthcare system has been effective in delivering quality care to all Americans and managing our healthcare dollars. Healthcare costs for our nation are ever increasing, and the system is the most expensive in the world. Yet measures of medical quality indicate that we are not living longer or healthier or receiving the best care we can for the dollars we are spending. And one reason why this is a current fragment, volume-based system is not accountable to payers or taxpayers or consumers for that matter, and is unsustainable. The Affordable Care Act recognizes the need for care, coordination, and accountability. In order to assure accountability, health outcomes and performance measures are needed to assess whether or not consumers are getting value for their healthcare dollar. It will be interesting to see in the next election what terms are these going to come to for the healthcare in the United States. But probably the biggest issue that was touched on a little bit earlier in regards to the U.S. healthcare system is costs are way too much. We often compare our system for healthcare to Canada's, which theirs is free, but we also say that they pay a lot more taxes, and so that is put into a pool where they can afford to pay for other people's taxpayers' medical bills. In reality, America pays more taxes, and that goes to more healthcare related stuff than Canada does. So that doesn't make any sense to us. All the truth is, the U.S. spends more on taxes on healthcare than any other country, and especially more for private healthcare insurances, which doesn't add up because taxpayers are paying more for less in terms of healthcare. Even more so, the U.S. exceeds the country in terms of spending more on private insurance healthcare. The public brushes this off as, America spends more on prescriptions or they're unhealthier than other countries, which, as data shown, is just simply not true. It's just a way for companies to charge us more. It's actually because everything costs more in that sense. For instance, a hip replacement in Germany might cost $13,000, while in America it'll run you about $100,000. A month's worth of the drug Lipitor can cost you about $124 in the U.S. Now, if you live in New Zealand, that's going to run you about $7 U.S. Now, it makes a little sense that we would spend a little bit more on the health insurance because we're a little bit more wealthy than other countries. Um, but we're not just spending a little bit more; we're spending a ton more. You know, so why are we spending so much on this stuff? They say overutilization is the term they use, and this refers to the idea that Americans spend more. Um, the idea that Americans spend more time at the doctor's offices and hospitals than other countries, which is simply untrue because studies have shown that Europeans frequent the doctors and hospitals on occasion way more than Americans. So why are we spending more than they are? Um, in the U.S., even if you have health care, you're still responsible for paying that health care, um, which is why our private spending on healthcare is so high, really. With doctor's appointments and co-fees, co-payments. Now, if you go broke paying for all these stuff, it sucks for you, but it sucks for the rest of us too, um, because the taxpayers have to step up, and they have to bail you out and pay for the rest of your bills, as well as paying for the hospital trying to attempt to you to pay for their bills and reaching out to you. So we're paying double for it. Um, and for this reason, providers they can charge whatever they feel like charging, and as well they can get away with, because it's hard to put a price on life and livelihood. Um, it's drug companies. When it boils down to it, it's government bureaucracy, and it's the ability to negotiate prices, and it's so much more. And it's not simply a problem that there will be a simple explanation to, because it's not a simple problem. And the longer it festers, the more it will drag on the American economy. Now, in my post, I put a couple questions for you. What do you think is the most problematic for the American system of healthcare, or what do you think we would change if you were in charge? Let me know, and whenever you respond, it'd be great.